On Monday of this week, I met with leaders, medical experts at the Texas Medical Center on Monday at 1 o'clock to discuss the coronavirus. Including in that meeting was one of the specialists that all of us are quite familiar with, and that's Dr. Peter Hartez at Baylor. And there were several other medical experts. In that meeting, Dr. Perce was there, Chief Pena with the fire department, Director Williams, and Eakin. We were all there for a medical briefing because I just wanted to kind of hear where things were, the lay of the land, how prepared the medical community was, and if there were additional things that I needed to know to convey to people in the city of Houston. They assured me, in fact, they assured all of us that hospitals and physicians and staff are prepared for the coronavirus response if it is needed. But let me stress from the very outset that there are no confirmed cases in the city of Houston, in Harris County, or in the state of Texas. I am aware that the University of Houston and other schools have suspended their professors, faculty, and students from traveling to and from China at the moment. So those reports, I'm sure, have heightened some people's anxiety. But I want to stress at this point that there are no confirmed cases in Houston, Harris County, or in the state. As a city, we have been closely following the evolving public health threat from a respiratory illness caused by the coronavirus, which was first identified in China. And although there have been more than 1,000 confirmed cases in China, as of today, there have been just a handful of cases confirmed in the United States, and there are no confirmed cases in the city of Houston. The Houston Health Department continues to monitor the evolving situation along with Dr. Perce, along with our Chief Pena with the fire department, all of our medical personnel, along with the Centers for Disease Control and Prevention, the Texas Department of State Health Services, and other public health officials. As a preventative measure, CDC will expand screenings to 15 additional airports, including George Bush Intercontinental Airport. The city of Houston continues to work very closely with CDC as logistics are being finalized. And at this time, Houston is waiting for further guidance or when screenings will begin. The city of Houston continues to stand ready with our partners to ensure our community is protected. But again, and I can't stress this enough, as of today, there are no confirmed cases in the city of Houston. It is important that people stay informed and pay attention to the advice of trusted health leaders. Don't listen to rumors or speculations, and don't share unconfirmed social media posts. That's one of the things that we are very concerned about, is that a lot of information is spread on social media that's unconfirmed and not fact-based. We want to emphasize to get your flu vaccine. I will say to you in our detailed briefing on Monday with the medical experts, what they emphasized more than anything else was for people to encourage, what they said, Mayor, encourage people to get their flu vaccine. It's not too late to get that because sometimes people conflate one with the other, okay? And so what they are concerned about more than anything at this point is making sure that people get their flu vaccine. So let me just say that, and let me assure people that as we get information, we will certainly make sure that that information is made available to people in a very timely fashion because we know there's a great deal of anxiety out there and it's being discussed and things that are happening in China. And so we are taking it very seriously, but I have every confidence based on the briefings that I've received that our hospitals and doctors and medical personnel, they are prepared and ready to respond and make sure that we get the information that we need in a timely fashion, and then we'll make sure that we get that information to you as well. Now let me pause, and I want to introduce Dr. David Perce, the local health authority for the Houston Health Department, to provide additional information. Dr. Perce.
Thank you, Mayor. And I'd also like to thank the hardworking, dedicated members of the Houston Health Department who to date have been putting in many, many hours late at night and through the weekend as we stayed on top of this situation. And similarly, our colleagues with Harris County Health and the State Department of State Health Services have also been working with us. And as the Mayor pointed out, we've been coordinating with the local healthcare community at several meetings to make sure that we are all leaning forward and prepared. But again, as the Mayor pointed out, and which is probably the most important thing for everyone to understand, is that there are no confirmed cases here in Houston, Harris County, or even the state of Texas at this point. A couple of things we want to reinforce. Some of the things you know, this is a virus. It's a new virus. And so that's important because what that means is that the human population on the globe, we cannot expect us to have any inherent immunity to this virus. It is brand new to the human population. Therefore, we are at risk for seeing the great amount of growth and spread of the virus, and that's what we're seeing happening in China. It is important that with a new virus that people become educated, and so the role of the media is very important. And I also want to reinforce what the Mayor said is that we need to be talking about facts and not rumor. We need to talk about things which are based in science and not speculation. All the speculation and all the rumor will actually set us back in our efforts to contain the virus should it start to spread in the United States. This virus, one of the challenges with this virus is that its initial symptoms are very similar, in fact, almost identical to the symptoms that we'll see with anyone with any other seasonal virus. And at this time of the year, there are many viruses that are circulating through the community. You've got the rhinovirus or the cold virus. We've also got the influenza virus, of which there's 2 circulating this year. And the initial symptoms are basically mirror each other. And so it's impossible for anyone to be able to look at someone and suspect that they have this virus. Today in Houston, since we know that we don't have any confirmed cases, the chances of somebody with symptoms of having the coronavirus is extremely remote. So that's not the case. Similarly, though, want to recommend that everyone pay attention to the fact that it is flu season. If we want to worry about what is the viral risk to Houstonians today, it is not the coronavirus, it is the influenza virus. Remember that many, many people, upwards of 10 to 20% of the U.S. population becomes infected with the influenza virus every year. And there are an average, somewhere in the neighborhood of 40,000 influenza-related deaths every year in the United States, and every single one of those is preventable. Every single one of those deaths is preventable because the person who died from the complications of the flu caught that flu virus from somebody else, who certainly inadvertently and not meaning to gave it to them. So how does that happen? Well, first of all, not enough people get immunized against influenza. That's the number one thing. The influenza vaccine from year to year, its effectiveness varies a little bit. It's never 100%. It's never 0%. But it does have a positive impact in reducing the chances that someone gets infected with the flu virus. And if that person doesn't get infected, they don't spread it. And for those folks who do become infected, the personal hygiene habits of washing your hands frequently, cleaning the surfaces that you touch frequently. Don't cough into your hand, cough into a tissue, or cough into your elbow. Very importantly, if you're ill, don't go to work. If your child is ill, don't send them to daycare. Don't send them to school. Take care of them at home until the virus passes, because the virus passes from one person to the next. Currently, as the Mayor pointed out, there is some travel advisories for the folks considering going to China. For folks who are returning from China, we want them to pay attention. Then, as they come back, the CDC is giving everyone cards of symptoms to look for, and then advising them that should they develop those symptoms, they should quickly reach out to the medical professions in order to have that managed. Because one of the things we want to do is, first of all, keep in mind that of the folks that are coming back from China who develop symptoms, and we've seen this in the testing from the CDC, most of those folks are testing negative. They've got a different virus causing their symptoms. In fact, in the United States, as you know, there are only 5 cases, none of them in Texas, but there are only 5 cases in the United States. When you compare that to how many people have returned from China over the last couple of weeks, actually a month or more, about 5 weeks now. I mean, I don't know what the numbers are, but they've got to be in the hundreds of thousands, and there's only 5. So the important thing is that those individuals did the right thing. They reached out to their medical professional, their doctor, or the clinic that they go to, and they were managed properly. And that is the key to us being able to manage this in the long run. So it's important that everyone base their decisions on the facts. Again, this is an evolving situation. Things are going to change. We should expect them to change. Your role in the media is so important. I can't understate it. I want to echo what the mayor said. Please report only the facts. Avoid reporting rumors and avoid repeating speculation, because that will absolutely hurt us in the long run. We want people to feel comfortable coming forward. We don't want them to feel like they're being persecuted. We don't want them to be afraid that the media is going to come and camp out in front of their house. That, if you look at the viral epidemics we've had in the world in the last couple of decades, you think of SARS, you think of MERS, and you think of Ebola. And the things that stopped those was the communication of the facts, particularly in the Ebola situation, where there was a lot of misinformation that was spread that caused a lot of fear of government, that allowed that epidemic to go on for much longer than it needed to. The role of the media in getting out honest information is integral to us being able to contain any viral outbreak, and this one is no different. Thank you.
Thank you. Now let me call on Frank Ciascio with the Houston Airport System. Did I get that name right?
You sure did, sir. Thank you. Well,
good morning. Frank C.
Good morning, everyone. Thank you, Mr. Mayor. On behalf of the Houston Airport Systems, we are working very closely with our federal partner, CDC, CBP, along with our City Health Department, Dr. Perce. Keep in mind, we are providing support to these agencies as well. CDC taking the lead along with the City Health Department. Currently at the airport at George Bush Intercontinental, even though we are designated as one of the 20 quarantine station airports, that doesn't mean we're quarantining anybody. We are evaluating passengers as they come through. We only see approximately about 5 flights a week from China coming in, and so as the travel ban is happening in Wuhan, we're seeing less and less, and it's dwindling down. However, CDC along with CBP are monitoring the situation. As Dr. Perce said, we are issuing health alert cards to all passengers coming in from China. If they exhibit any symptoms, they're asked to contact their physician or health authority, and if we see something at the airport, we'll go to a secondary screening with our CDC partners. Outside of that, travel is continuing as usual with no bans, no effects, no nothing at Bush Intercontinental Airport, and we continue to monitor the situation and work very closely with our federal and city partners. Thank you very much.
Thank you. And I know there's been some questions as whether or not the city or the health department doing anything in any particular community, like specifically in the Asian community. That's not true. But State Representative Gene Wu, if you want to make some comments in reference to that.
Thank you, Mayor. Gene Wu, State Rep for Southwest Houston, House District 137. And I've gotten a lot of messages from the Asian community, especially upon hearing messages off of WeChat, off of Facebook, off of Twitter, and universally every single one of those scares or warnings or alerts are all universally false. And I want to make this absolutely clear, not only to our local ethnic media, but to anyone, all of our citizenry on social media. If you do not hear it from the city, it is not true. I want to say that one more time. If you did not hear it from the city and from a health official, it is not true. And I need everyone to remember that and to tell people on social media that everyone has an obligation on social media to make sure we don't hurt ourselves more by spreading false rumors and speculations and just random nonsense that people want to talk about. Over the last week, I've seen multiple messages. People are spreading that the virus has popped up here, there, and everywhere at certain stores, at certain restaurants. Every single one of them is false. Every single one of them is false. And once again, if you spread these rumors, if you spread this misinformation, you are doing harm to your own community. Because when there is something actually important that needs to come out, that the city needs you to do, or a warning that actually needs to go out, then people are no longer listening. So once again, I hope that everybody on social media, I hope all the ethnic media within Houston, make sure to only report the facts, only report what's true, and if you did not hear it from the city, it is not true.
Thank you. And Chief Pena, if you would come and, again, emphasize that message, and if you don't mind, also in Spanish as well.
Absolutely. Good afternoon. So, again, just to reiterate what has been mentioned here today by both the health officials, state representatives, and the mayor, is that the main thing to focus on is personal hygiene. If you feel sick, stay home, call your physician. Wash your hands. Be mindful of the personal hygiene aspects. And more importantly, we need to ensure that we're getting our flu vaccine. The Houston Fire Department, we are making some adjustments for our personnel as well, and ensuring that we are providing all the equipment that we need for body substance isolation and those types of deals. And again, we're taking our precautions, our hygiene precautions. So we're not doing anything above and beyond what we would normally do for the flu season at this time. Okay. En español, lo que les queremos recomendar es que acudan si se sienten mal, que se estén en casa y acudan a sus doctores, ¿sí? Hay más incidentes de flu que este virus nuevo, ¿okay? No ha habido ningún caso en Houston, en Harris County o en el estado de Texas acerca de la coronavirus. No ha habido ningún caso. Lo que les recomendamos es que si se sienten mal, que se mantengan en casa y que hablen a su doctor. Es importante que reciban su vacuna de flu cada año y que ejerciten sus cuidados personales, ¿sí? No tosan en frente de otras personas y se sienten mal. Si sus niños están mal, no los manden a la escuela o a la guardería, manténgalos en casa y manténganse ustedes en casa si se sienten mal. Acudan a sus doctores y reciban sus vacunas. Sí. Gracias.
Thank you. And then finally, Director Williams, I know we've put some information up on the website because we want to make sure that people have a place where they can go if they want information about this, the coronavirus and the steps that they need to take, precautions. If you'll come and just explain where they can find that information.
Just to reiterate, what you've heard today is what we in public health do in order to prevent the spread of disease. If you want to access flyers, all you have to do is actually go to our website at houstonhealth.org, or you can call our main number. If there are any questions, feel free to contact the health department so that you can get more accurate information.
Thank you. If you have any questions to any of these individuals, this is a good time.
Dr. Thompson, Health and Development Magazine. Thank you for your presentation. Thank you for the distinguished leaders in the different disciplines related to this issue, coronavirus. First, Dr. Perce, you said that the coronavirus that we are dealing with is a new virus, but there is this information that tells us that it may be related to the 1990 virus in China, maybe a different strain which have not been managed properly. My second related question is the issue of the politics of virus. We actually know that as it relates to vaccines and immunology, Peter Hotez, who is at the Texas Medical Center, can tell you that Americans and American physicians are in the forefront of making a whole mess of the importance and usefulness of vaccines and all of this because of the money and materialistic benefits they get from there. And thirdly, what's the relationship between direct flights from China to the Bush International Airport and these flights that first land in California and then transit to this area, which is related to the two cases that we have had with Baylor and AMN? And you are saying that they are unrelated to anything people should be concerned about. But if they are unrelated, we have false and positive issues which go with the test, which are not specific. Thank you. Those are my questions.
Thank you. Yeah, and let me ask you to and you gave 3 questions, which could take quite a time. Would you pick one and answer?
Okay. So your first question was about this being a new virus and it possibly being related to viruses that existed before. And what we're hearing is that this is a new virus. They have sequenced the virus. We actually have the DNA sequence of the virus, and those are available to the researchers that are looking at it. And it is not uncommon to find that there is overlap between a new virus and previous viruses that circumnavigated the globe, I should say. So there is overlap in that DNA sequencing, and that is not my area of expertise, so I will tell you that I know that there is overlap, but in the end, this entire sequence is new, and what is important to understand is that because it is the entire sequence, the DNA sequence is new, that means that the characteristics of the virus and how it will behave is somewhat unpredictable, and that's why it's so important that we pay close attention to how people are becoming infected and how their bodies are reacting to that. It is a new virus. Yes, there is overlap, but it may be related, but it is absolutely a new virus. From a scientific and a practical standpoint, it's a new virus.
Question.
And Dr. Perce, I know you said no confirmed cases. Are there any suspected cases, and are you testing for the novel coronavirus in any patients?
Yeah, thank you for asking. So we don't discuss suspect cases. That's a rule we've had with the health department, both the city and the county. I'll speak for them. We don't talk about suspect cases for a number of reasons. One is that in the end, when it's all over, the number of suspect cases we may have is going to far outnumber the number of actual cases that we have, exponentially generally. It's generally at least a 10-to-1 ratio of suspect cases to actual cases. And when we talk about suspect cases, people misinterpret what that means. They think they're confirmed cases. People react in a way that they don't need to. It sets off unneeded panic, and it then changes the way people behave in a way that actually makes the situation worse. So we don't discuss suspect cases. What I can tell you is we have no confirmed cases in the city of Houston, Harris County, or the state of Texas.
And, quick question for me also for Representative Wu. I know you talked a lot about the rumors that are out there. We've seen them too.
Yeah.
What kind of impact is that having on businesses in your district?
I think one of the most prominent, I think Channel 2 or somebody covered that the people were spreading rumors that one of the local grocery stores, Asian grocery stores, that the owner came back from Wuhan or something to that effect, and dramatically, that got spread like wildfire into the rest of the community. There was no such dangers. There was no such infection or anything like that. Again, completely made up whole cloth by essentially one person, either maliciously or as a stunt, and that has caused that business significant economic harm.
And that's one of the reasons why we wanted to hold this press conference, because it's so important to get out just accurate, factual information, and you all are such a vital player in all of this. So I certainly want to thank you for being present.
As
Yes,
far as
ma'am.
airport screenings, when can we expect those to begin at George Bush Intercontinental? And can you kind of walk us through what that would mean for passengers? You did mention quarantine as well, which I would like to know about.
Okay, I want to stress, again, it's labeled as a quarantine station. That's been something that has always been around, okay? We're not quarantining anybody, we're not quarantining flights, but it's called, under CDC guidelines, a quarantine station. There's approximately 25 of those or so at major airports around the country. We don't know yet when we're going to start the screening process. That's still being decided with CDC. Once we get that information and their protocols are completed and stuff, we'll initiate that. The mayor, Dr. Perce, will be advised of when that will happen, and then there'll be a certain protocol that will be put into place. Plus, we'll have CDC officers that will be coming to assist us. But again, all this is still being worked out between CDC and CBP. If I can, Mr. Mayor, answer your question regarding the flights, we only have 5 direct flights a week out of George Bush Airport to China, and then on return. The other flights that are non-direct flights are going to the other airports first that have been earlier designated by the CDC. They're processed there and they come here. We see no reason, and we're talking with Dr. Perce and all, we don't see any problems with domestic travel because those people that have gone to those other cities first have been cleared and come through. So again, we only have 5 flights a week, out of George Bush.
So you can't speak to what the passengers can expect when those screening processes begin? I mean, will they even know they're being screened, or are they walking through some kind of machine?
No, I won't go into detail on that because that's being worked out. But passengers from China will be given a health alert card that Dr. Perce mentioned earlier and stuff. They will just go through the normal process. If something, if a CBP officer notices something or they self-identify, then a CDC officer will ask them additional questions, pull them off to the side and ask them additional questions. And that's it. We're not, there's no reason to segregate anybody out, so we're doing all we can to support the CDC, and I think they have a good plan once we initiate it.
So there's no CDC staff on scene right now, right?
We do have, Houston is a CDC staffed airport. So we do have CDC 24/7 at the airport there. And then additional CDC staff will come in to support them.
And you said there's always been a quarantine area?
No, let me stress this. There's a difference between quarantine. It's labeled as a quarantine station. We are not quarantining anybody. There is no plans to quarantine. That's what the CDC has always labeled them. And maybe Dr. Perce could add a little bit more to that, but we want to caution you. That's what it's called, a quarantine station, but we're not quarantining anybody.
But you have an area prepared in case?
There's always an area prepared on normal days, and we always have an area prepared for this and for other things. Remember, we see over 20 million passengers a year, international passengers that fly into Bush Airport, whether from Europe, Asia, South America, and so we always are, there's always things that potential passengers can bring in, so we are always prepared.
And is the airport passing out information on scene today about coronavirus?
CDC is passing out at the CBP checkpoints. They are issuing a health alert card. The airport itself is not. We do have messaging on our monitors in our federal inspection station area and in our Terminal D, the international, and then on the ticket counter areas, there's messaging from the City Health Department. So we are getting the message out. The message is there, but the airport itself is not specifically giving them.
We'll have a few closing comments from the mayor, and if anybody has any additional questions, they will be available to speak to you.
Let me just say, in our meeting on Monday at the Texas Medical Center, and I want to thank Bill McKeon for organizing and pulling in a number of different medical experts. And the understanding that we came to is that if there is any case that's confirmed, any factual information that needs to be made available, we will quickly make that available, and it'll be made available to Dr. Perce, to Chief Pena, to Director Williams, myself, and then we'll make that information available to you. Because we want people to know that we intend to be very transparent, provide people with the factual information. But they wanted to walk all of us through to let us know that there are no confirmed cases, that they are prepared. The hospital network in the city of Houston and Harris County is prepared to deal with this situation should it occur. They wanted us to emphasize the fact that what they're more concerned with at this point is the flu, and wanted people to take the necessary precautions to do that, to handle that situation. And then we want to just make sure that we tamp down rumors, because once it gets out there, as you very well know, especially with social media, it will simply spread. And so that's one of the major reasons why we wanted to hold this press conference today. And we'll hold them as necessary. Because it's an evolving, fluid situation, and we just want to stay on top of it. If by chance something should happen, let's say there is a confirmed case, then we want people to know that, okay, this is the deal, okay? But we don't want to heighten people's anxiety, and then when we really need people to respond, they're less likely to respond. Yes, sir.
Mayor, can I ask you a few questions about the guest list closure? That's okay. The guest list.
Okay. Anything else on the coronavirus?
Yeah, we'll let everybody.
Yes, I do.
What you got?
I want to ask a question to Dr. Perce through the mayor. China has actually accepted WHO medical and health scientists to come in but not United States medical and health scientists coming in on their own or through their institutions. What do you think that aspect of the politics could play hindering the effectiveness of prevention?
Well, let me intervene on the political question because I think that's one that's probably above our pay grade. Okay, so I hear you, and I'm sure any one of these gentlemen, ladies, would be more than happy to respond on the side. Okay, okay.
Quick question about
sure.
coronavirus. I just wanted to get an estimate of how many actual people are coming each week from China or going to China. You said 5 flights.
Out of those 5 flights, you're probably looking at maybe somewhere in the neighborhood of around 2,000 passengers a week.
Coming or going or both?
Well, we're interested in the ones coming, so that's the one that we monitor. So you're looking at about 2,000 passengers.